Okay, so since I wasn't able to be in school, in order to do this skill, I will be saying the steps out as if I were doing them. So first I would read the care plan, I would knock on the door, introduce myself and my skill. So I would, "Hi, Mr. Jones, I'm Juliana. I'll be your CNA today and I'll be providing mouth care. Is that okay?" They would say, "Yeah." And then I would close the curtain and wash my hands, and I'm going to gather my supplies. And my supplies would be a barrier for the table, a washcloth, a towel, toothpaste, denture brush, a basin, toothlet, a cup of water, and 2 pair of gloves. Then I would fill the cup up with water, and then I would get the denture brush and wet it, and then apply toothpaste to both sides, and then place it in the basin. Then I would bring the basin over to the sink, apply my gloves, and then I would take the washcloth, put it at the bottom of the sink so I do not damage the dentures if they were to fall. And then I would use a paper towel, turn on the sink, and only use cold water. Then I would rinse the dentures using only cold water and brush all surfaces, removing any food particles or food left behind. And then I would rinse the denture brush, place it back in the basin, and then rinse the denture cup, and then fill up back with cool water, and then place the dentures back in there. I would turn off the sink with paper towel, and then get another paper towel, take the denture cup, place it there on the sink while I get the washcloth from the bottom and drain it. And then I would take that washcloth, put it in dirty linen, and then I would go back to the sink and get the basin and the denture cup, and then I would take the basin back to the table, and then I would place the denture cup on the bedside table. Then I would remove my gloves and throw them away, and then ask him if it is okay if I place a towel over their chest, and they would say yeah, so that we could protect their clothing while we brush their gums or teeth that they have left. And then we would take the toothlet, and then we would wet it, apply a little bit of toothpaste, and then place that back in the basin, and then apply a new set of gloves. Then I would brush all surfaces of their mouth, bottom and top on both sides, and you would allow them to stick their tongue out so you can brush their tongue. And then you would throw the toothlet away, and then allow the patient to rinse as many times as they like, at least 2 times, and also pat their mouth dry so they don't have anything, left on their mouth. Then I would remove the patient's towel and place it in dirty linen, throw away the cup, and rinse and clean basin, dry the basin, take a paper towel, and place denture brush and toothpaste back in the basin, and then with a paper towel, place it back in the drawer. I would then remove the barrier, throw it away, and remove my gloves and throw them away. Then I would do my closing, so I would ask Mr. Jones, "Are you comfortable? Would you like a magazine?" "No?" "Okay." And then I would place the call bell to make sure that it is in sight and they can reach it. And then I would open the curtain and wash my hands. And then I would say any corrections that I would need to do. And then I would say, "My skill is complete."